अस्सलाम वालेकुम। मैं आपका अपना डॉक्टर अनवर फारूक। आज हम बात करेंगे एंकलोजिंग स्पॉन्डिलाइटिस के ऊपर। ये क्या होता है? फर्स्ट ऑफ ऑल, इट्स डेफिनेशन, इट्स सिम्टम्स, इट्स causes, and when to see a doctor, types of the ankylosing spondylitis or complications, risk factor, treatment. So let's start our lecture about ankylosing spondylitis. What is the definition of the ankylosing spondylitis? Ankylosing spondylitis is a type of arthritis that cause inflammation in the joints and ligaments of spine, and over a time it caused stiffness. Remember, ankylosing means stiff and spondylo means vertebra. This is an autoimmune disease. Ankylosing spondylitis is also called progressive arthritis. Ankylosing spondylitis is also known as axial spondyloarthritis. The vertebra started to fuse. This fusing makes the spine less flexible and can result in a hunched posture. If ribs are affected, it can be difficult to breathe deeply. Types of the ankylosing spondylitis. Axial spondylitis arthritis, axial spondylar arthritis, ankylosing spondylitis, in which the condition is found on X-ray. Number 2, non-radiographic axial spondylar arthritis, in which the condition cannot seen in X-ray, but it found based on symptoms, blood test and other imaging tests. Symptom typically begins in early adulthood. Inflammation also can occur in other parts of the body, most commonly the eyes. There is no cure for ankylosing spondylitis, but treatment can lessen symptoms and possibly slow progression of the disease. Symptoms of the ankylosing spondylitis. Early symptoms of the ankylosing spondylitis might include back pain and stiffness in lower back and hip, especially in the morning and after periods of inactivity. Neck pain and fatigue also are common. Symptoms of the ankylosing spondylitis. These areas most commonly affected are: number 1, the joint between the base of the spine and the pelvis. Number 2, the vertebra in the lower back. Number 3, the places where tendon and ligaments attach to bones, mainly in the spine, but sometimes along the back of the heel. Number 4, the cartilage between the breastbone and the ribs. Number 5, the hip and the shoulder joints. When to see a doctor? If you have lower back or buttock pain that came on slowly, is worse in the morning. If the pain improves with exercise and worsens with rest. If you have developed a painful red eye, severe light sensitivity or blurred vision. Causes of the ankylosing spondylitis. Who have a gene called HLA-B25 are called greatly risk of the developing spondylitis. Risk factor. These people who have genetic factors, complications. When the newborn gradually bridges the gap between the vertebrae and the eventually fuses sections of vertebrae, these parts of the spine become stiff and inflexible. Fusion also can stiffness the ribs cage, restricting lung capacity and function. Other complications might include eye inflammation, or uveitis also include eye pain, sensitivity to light and blurred vision. B. Compression fractures. People with weak bone, weakened vertebra can crumple, increasing the severity of the stooped posture. Vertebral fractures can put pressure on and possibility injure the spinal cord and the nerves that pass through the spine. Heart problem. Ankylosing spondylitis cause problems with the aorta. The inflamed aorta can enlarge the point that it distorts the shape of the aortic valve in the heart, which impairs its function. Treatment. In homeopathy, there are a lot of medicine which can be treated according to the symptomatology. बहुत सारे पेशेंट ऐसे आते हैं जो आके ये कहते हैं कि डॉक्टर साहब जो है मेरे जो कमर के जो मोरे हैं उनके ऊपर नोकें बढ़ गई हैं और ये आहिस्ता आहिस्ता इकट्ठे होते चले जा रहे हैं और मैं ना झुक सकता हूँ ना कोई काम कर सकता हूँ। इससे पहले कि देर हो जाए आपको सारे टेस्ट के साथ किसी अपने अच्छे माइलेज के पास चले जाना चाहिए। होम्योपैथी में इसका इलाज है, लेकिन अगर आप बर वक्त किसी अच्छे डॉक्टर के पास चले जाते हैं। वीडियो को लाइक और शेयर ज़रूर कीजिएगा। बहुत शुक्रिया। थैंक यू वेरी मच।